According to the latest figures, some 1.8 million people in Germany suffer from dementia.
The disease is absolutely degrading. It's brutal.
Grausam.
In 2019, Julia discovered that her mother had it too.
The day I really knew the time had come to do something was when I observed her cutting this big, long ivy hedge with nail scissors.
After that, Julia moved her mother in with her.
By the third month, it was clear things couldn't go on. Either we would fall apart or she would.
Sophia has just begun training in a specialized nursing home. For her, it's a dream job.
First, you must learn the proper way to interact and learn what to do. When they tell you about the past, you find out quite a lot about them.
What does a good home for dementia patients look like? We've been accompanying people who are trying to answer that question. 48 people with advanced dementia live at this nursing home in the town of Euskirchen in western Germany. 19-year-old Sophia has just started her caretaker training here.
Hello, Mrs. Karls. You doing okay?
Yeah.
You look nice today. That's a nice pink.
I always like to wear this. It's a nice color.
It is.
Margot Karls has been living here for 4 years.
I'm doing well. I'm glad when I'm healthy and I can come here. I always like to be here, among other people. Who knows for how much longer? I'm pretty old. I was born in 1930.
Oh, you're already done? Would you like some more?
No, I'm full.
These people live here, so they should feel at home, feel comfortable. If they can enjoy their final years here with us, that makes me happy. Shh, don't tell anyone.
At this nursing home, the focus is on the individual and their unique needs. Sophia's interest in dementia care didn't come out of nowhere. It's also something she's experienced in her family.
My great-grandmother suffered from dementia. I was much younger then and thought I'd never do that job. I don't want anything to do with it. But now, through this job, I think it's super nice. Sure, I wish I'd been able to help my great-grandma, but I found it strange back then.
Sophia was 7 years old and couldn't comprehend what was happening to her great-grandma.
When caring for those with dementia, you must be patient and calm. Everything must stay calm, and that's something you have to learn. I'm partially responsible for giving these people a nice home, right where they are. And I want to ensure they're doing well and that I'm looking after them properly.
Most people suffering from dementia are cared for at home, something Julia also did for her mother for 7 months.
Look, I have Grandma's paintings. I don't know if you remember them.
I haven't seen them in a long while.
When I look at these pictures, they make me cry. Because that's the woman she was. There's not much of a connection to the woman currently in the nursing home. These paintings show that she was highly spiritual and maybe a bit eccentric. But the chance to learn more about her is gone now.
Julia's mother's dementia has since gotten worse.
Do you remember where that is?
Yes, at the beach.
Grandma's favorite place.
A Pilsner with a fish roll. It was always great. A really nice time.
So sweet. As soon as she saw the sea, it was, oh, I'm home.
Yeah, that was really nice.
And here her patience was wearing a bit thin.
Yes, that should have set the alarm bells ringing, because she was acting really odd. She was totally reserved, yet slightly aggressive, and very insecure.
After the diagnosis, Julia took her mother in and cared for her at home. Then she embarked on the tough search for the right nursing home.
Do you remember that you used to like to paint?
Yes.
I brought one of your paintings, and I'd like you to tell me what you see.
I see what's going on.
Yes, tell us.
Look, there's a man with a coat. The sun is out, here, there, and there, and there. And there's a heart. A Herrensherz.
What's a Herrensherz?
A man with his... And he did that with me, too.
It's really nice. Do you know who painted it?
No.
You.
Back in Euskirchen, families of people suffering from dementia often experience years of turmoil before their loved ones go into a care home.
Our birthday girl!
Goodness, you've all gone to a lot of work. It's wonderful.
And now we can start serving the egg liqueur.
Can we sing happy birthday?
I don't know.
Should we try?
Let's try.
Happy birthday to you. Happy birthday to you. Happy birthday, liebe Hertha. Happy birthday to you.
Lydia Kassing is the home's director. She spent her entire working life in caregiving.
When people come to us, their relatives have usually cared for them for a really long time, for many, many years. They've invested an incredible amount of strength and provided a lot of support. And I think they often don't notice if they're getting a bit cranky, not getting any sleep, or no longer have the strength. Monica!
Happy birthday!
Thanks.
94.
94, yeah.
A proud age. My mother started to change and just didn't want to leave her house. But we managed with the help of caretakers, a bed on the ground floor, and food from a catering service. We drove there often to help her.
It's great to see you.
Of course, and more are coming too. Svante is coming with Nevin and Marlon, and Lucas is bringing Henry.
The place will be packed.
It'll be packed. And then came the flood. My mother came and stayed with us for 2 years because we noticed she was getting progressively worse. So we cared for her at our home for 2 years, until even that no longer worked. It's not so easy to put your mother in a home so quickly. We'd arranged it with her before. When you can no longer cope, we'll take you in. So to then turn around and put her in the hands of strangers was a tough road to take. Everyone in the family, the immediate family, knew it before I did.
That things couldn't go on like that.
Yes, and that I also needed help. I discovered sides of myself that I didn't know existed. I didn't know they were there, but they were. Yes, you do reach your limits.
While looking for good nursing care for her mother, Julia came across Teun Tubis. The Dutchman has written a book on this subject and offered to talk to her about it.
Where you live, are the residents all dementia sufferers? Or are there other older folks too?
No, there are just people with dementia in our unit.
And how many people live there?
130.
Ah, okay. And what I found out is that you've created a safe place where you try to replicate normal daily life, make things as normal as possible. Is that correct?
We have a very nice initiative, but it's an exception to the rule. I think we have this image that the Dutch healthcare system is very good, but the foundation of our system is still illness, not humaneness.
Teun, thank you. I'd be really glad if we could keep in touch.
Absolutely.
The young man from the Netherlands advocates for building communities that care for people with dementia in an inclusive environment. That's why he moved into a closed care facility for dementia patients just outside Amsterdam.
I love my housemates. Yes. What I've learned from my housemates in the last 2.5 years, that you can engage with every person, no matter what stage of the disease they're in.
Teun Tubis is a trained caregiver with a degree in care ethics. His experiences have motivated him to advocate for a reform of the care system. He believes the key is to view dementia care as a communal responsibility.
When we really see people with dementia as people, like you and me, then we see all of the regulations, protocols, and the ways in which we have set up this system from another perspective. Cheers to your health.
When the disease has progressed to a certain stage, relatives become a patient's authorized representatives. It's a big responsibility and comes with many challenges.
She stayed with me for 7 months, and for the first 4, things were great. For a long time, she was mentally quite fit. She spent an incredible amount of time outdoors. I saw that she blossomed here, and she was so grateful.
Yet once dementia has taken hold, there's no stopping it.
But then things became more and more difficult. The most trying thing was the unpredictable emotional outbursts, sometimes spiteful, that were so unlike the mother I knew. Emotionally, that was the worst thing for me, that she could be so cruel, even though I'd done so much for her.
Julia cared for her mother until she suffered from burnout.
In the mornings, I really had reservations about going downstairs. I didn't know what awaits me today. What condition is she in? What spiteful remarks must I listen to today? Will she let me touch her if she no longer knows that I'm her daughter? But I had committed myself to provide loving care, so that was a challenge. At some point, I thought, I'm going to fall apart.
This nursing home in Euskirchen doesn't believe in sedating patients. Here, agitation and strange behaviours are seen as expressions of discomfort or unease.
Can you help, please?
Mr. Weberhorst, should we take a little walk?
Yes.
Come. I think we need to freshen you up a bit. We'll clean you up a bit. Come and stand by the sink.
In the later stages of the disease, dementia patients need care 24/7. And that's typically when family members like Frank Zurawski need help urgently. His mother has lived here for the last 3 years.
There's no alternative. There's no alternative to this round-the-clock care. And that works quite well here.
Now let's stop talking about it or I'll start bowling. That's it, okay?
Of course.
She's a really nice woman.
I could never have imagined my mother being in a situation like this. It's a tough pill to swallow.
You know, I wouldn't say anything now. If I say something, they'll say, listen to that.
No, no one's saying that. It's absolutely degrading. The disease is absolutely degrading. It's brutal.
Then you must keep telling yourself, we can do it.
My husband always says, together we're strong.
Accompanied by her other daughter Carolina, Julia is en route to her mum's nursing home, near Kiel in northern Germany.
When were you last there?
3 days before Easter.
It's not just people with dementia who live here. Julia searched far and wide until she found a home that she too felt comfortable in.
Hi, Mom. Hi, you. Ooh, exciting.
Grandma, can you come here? Grandma, it's me, your granddaughter.
Yes, I know. And Charlie is also happy to see me.
Ever since she's come here, she's been really stable and in a good mood. When we come, it's like the sun comes up. I'm no longer fearful. Emotionally, it's always a bit intense because, sure, it's a little sad at times, but we have an incredible amount of fun too.
My mother is happy. She's in a good mood. She's really glad we're here, and that's the main thing.
Look, Grandma, do you remember him?
Of course.
This is Charlie.
Oh, lovely. He's so cute.
This is her place. She feels totally comfortable here. And she can get up and go back there to the common room where they play music. She decides that all on her own, which is very nice. It's really important to my mother that no one tells her where to go and when.
Even when memories fade, emotional experiences remain.
That I can experience this again, the way I do here, is wonderful. Very nice, very nice.
He's singing just for you.
Sometimes even the beautiful moments can be difficult.
You do that so well, Mom. That's so nice.
Studies show being part of a community has a positive effect on dementia patients.
Are you ready? There are flowers downstairs waiting to be planted. Who wants to join?
I have a garden at home too.
Can you put on your jackets? It's cold down there. We're planting flowers for this summer. May I have this dance?
Come with us. Come.
Of course.
Ulrika Kreuer is planting something called a dementia garden. These sensory gardens are planted and tended by caregivers, residents and their families.
Do you want it on your walker? Look, it's bright yellow. There, I knew it would fit. Orange. Leo, will you take them?
Super. Now we can go and bring them back to the table.
Let's go.
Like in many such facilities, the doors are locked for security reasons. Yet the garden is normally open to all residents.
The special thing is that now we can plant fragrant plants. Then in the summer we can pass by the garden and smell and touch the flowers. So we can really create a place that's nice to spend time in.
Leo, do you want to take this little green plant?
I have to carry this.
You can leave that here for a while.
You can put that in the middle flower bed. Yeah, and you can carry that too. Sure.
Last year was really rough. I was at the end of my rope. There's no real treatment for this illness, at least not yet. He's been here since October. What's really great is that every week I pick him up for a couple of days and he can stay the night. And now I don't feel like I've shunted him off somewhere. We've been married for 55 years. Think about that. It's a long time.
A long time. 55 years of marriage.
Yes.
We have to keep engaging with every person and their family. They bring their whole life with them. And that should continue here with us. We want to get to know them, and we try to create a sense of togetherness here, to make it their home.
Teun Tubis was asked to give a presentation at Berlin's Digital Society Festival, Republica. Its motto for 2024, Who cares?
Today I'm going to deliver a message about changing the way we view dementia. We're creating a movement. That's the most important thing. To inspire people, get them talking about their experiences. We need to share factual information. And the fact is, people with dementia are still people like you and me. So that's why I'm here today.
Teun Tubis now travels the world, sharing his experiences. He believes it's essential that society comes to grips with dementia.
Hi. Hi, my name is Teun.
Bernsee, hi.
Today's message isn't always pleasant, but it's necessary. It's essential that we change the way we treat people suffering from dementia. My name is Teun Tubis. I'm 25 years old, and my mission is to improve the quality of life of people with dementia.
According to a World Health Organization report, the number of people with dementia could increase by around 40% by the year 2030.
Dementia doesn't just affect the healthcare system, but society as a whole. It's not about new nursing homes or nice buildings. It's about having a vision. We need communal living. There's not just one solution. There are many different possibilities.
Dementia is one of the most common afflictions among elderly people.
You have to figure that you'll get sick in your old age and contract a fatal illness. I'd wish for a different future, though, where I have a say in what happens.
Then make that happen.
I will.
Your hand's warm.
Yes, you like that. And you have cold cheeks.
I do.
Right. Come here and let me give you a kiss.
Oh, wonderful.
He likes that.
Warm, warm.
Warm, warm, warm. Warm, warm, warm.
To this day, there's still no cure for dementia.
I didn't want to give up so quickly. I thought, I've raised 2 children. I'll be able to figure this out with my mother, too. But when I brought her to the facility, I felt a huge sense of relief.
If I had dementia, I'd absolutely want to be treated with respect. And that people took notice of how I'd lived before, my preferences, for example. That'd be nice.
Ja, das wäre schon schön.